here from Vet Triage. This would be January 28th, 2025. We are almost done with this issue of JAVMA from March of 2017. We're going to talk about rabbits, the glomerular filtration rate determination by computed tomography in two pet rabbits with renal disease. This comes out of Universite de Montreal, Canada, as well as a hospital in France. So, case description: a 3-year-old and 7-year-old female spayed rabbit were evaluated because of digestive stasis associated with renal asymmetry. Clinical findings: there was neoplasia of the right kidney diagnosed via cytology in the 3-year-old. Uterolithiasis of the left kidney was diagnosed by ultrasound in the 7-year-old. To evaluate whether unilateral nephrectomy was indicated, they did an evaluation with glomerular filtration rate, that's GFR for short, by dynamic computed tomography, which is CT-GFR. Treatment and outcome: the rabbit with renal cancer underwent radical nephrectomy without complication. The rabbit with uterolithiasis underwent ureteral stent placement, and the renal pelvic dilatation resolved. Both rabbits maintained unremarkable serum urea and creatinine concentrations after surgery. So let's go into some details. 3-year-old female spayed rabbit had gastrointestinal stasis. They were treated with IV fluid therapy, lactated Ringer solution, gavage feeding, buprenorphine, midazolam, enrofloxacin, metronidazole, cisapride, and cholestyramine. The rabbit had severe polycythemia. She had hemoglobinulemia, hypoglycemia, elevated creatinine, elevated creatine kinase, and low specific gravity. Abdominal ultrasound found a well-defined hyperechoic, heterogeneous, poorly vascularized right kidney mass. There was no evidence of vascular invasion or abdominal metastasis. The cytology revealed renal carcinoma. They did the evaluation of the GFR by the means of the CT scan under buprenorphine, midazolam, propofol, intubation, oxygen, isoflurane, and lactated Ringer solution for fluids. They use a 16 detector array helical unit, that's a CT scan, 3 sets of scans using baseline, meaning initial whole body helical scan before contrast medium administration. They did dynamic, which is a post-contrast single slice scan to measure clearance of the contrast medium and the renal volume determination. Here is the picture up top. Is without contrast. That massive, the structure with all the bubbles is probably gastrointestinal tract. The opposite side is probably the kidney mass. But then you can see it clearly in the post-contrast that spherical, that ring is contrast in the normal kidney, and the other one is only partially contrast enhancing, and that's the abnormal kidney. The plasma clearance value is multiplied by renal volume to obtain the value of overall renal clearance rate. This overall value is divided by the subject's pre-anesthetic body weight to obtain the GFR. GFR in the rabbit was estimated at 0.65 mils per minute per kg for the left kidney, which is a normal kidney, accounting for 83% of total GFR, whereas the right kidney was only 0.13 mils per minute per kilogram. The lack of glomerular filtration peak on the time attenuation curve suggested overall pre-renal kidney failure, and calculated values indicated minimal contribution to renal function by the cancerous right kidney. The cancerous right kidney was considered to be a potential cause of pre-renal kidney failure because the cancerous tissue could have been producing an excess of erythropoietin, leading to the erythrocytosis. Because the packed cell volume is used to calculate the GFR, polycythemia resulted in a decreased GFR. Subclinical dehydration secondary to pain, related gastrointestinal stasis caused by the mass by the mass effect of the neoplastic kidney could also lead to a high packed cell volume and pre-renal failure. Considering the minor contribution of the diseased kidney to the overall GFR, they believed nephrectomy would help. Mass was 80% of the renal volume, and it came back as a renal nephroblastoma, so the original cytology was incorrect. Plasma creatine improved. and the paxil volume improved, specific gravity improved. On to the second case, 7-year-old female spayed rabbit, left renal and ureteral lithiasis. Abdominal ultrasound showed occlusive ureter stones and severe hydronephrosis with 2 nephroliths in the left kidney. The CT GFR was performed. The GFR in the normal kidney was 1.02 mils per minute per kilogram, representing 62% of total GFR. The left kidney was 0.62 mils per minute per kilogram. The total GFR was below the lower limit of 2.5 mils per minute per kilogram, expected in other species such as cats. The finding of a decreased GFR without azotemia was consistent with a diagnosis of subclinical bilateral renal insufficiency without compensatory hypertrophy of the right kidney. Morphological evaluation revealed a left ureter large enough to allow placement of a stent, so they placed the stent and preserved both kidneys. Discussion. Kidney disease is common in pet rabbits, with renal lesions identified in over 70% of geriatric rabbits at necropsy. This could be related to infectious nephritis like encephalozotoin cunulii, or kidney stones secondary to metabolic imbalances such as high dietary calcium or insufficient water intake. Although less commonly identified in rabbits, primary or secondary renal neoplasia, congenital defects, and other conditions such as pyelonephritis and amyloidosis may develop. Primary kidney disease generally progress insidiously to chronic renal failure with nonspecific signs like weight loss, lethargy, and developing in affected animals once 50 to 70% of the nephrons lose function. In the picture below, you can see the different structures of the kidney there. We already mentioned the ureter, there's the nephron, and so you can look at that as well. Urine-specific gravity is naturally low in rabbits compared to other mammals because the kidneys have poor concentration ability, making isocynuria a normal finding. Proteinuria can be normal after physical exam or stress. Glucosuria is not considered abnormal in rabbits and other species with signs of distress or pain. The high susceptibility of rabbits to stress can therefore hide urinary changes in the early stages of kidney dysfunction to a greater degree than that of dogs and cats. Measuring routine blood work is fairly insensitive for kidney disease in rabbits. The limited ability of rabbits to concentrate urea requires the excretion of greater volume of urine to remove the same nitrogenous waste as in other mammals. As a consequence, when a rabbit is dehydrated, urine volume will decrease and it may not be able to excrete as much nitrogenous waste, such as a dehydrated cat or a dog. Therefore, pre-renal azotemia develops more readily. Plasma urea concentration is influenced by variables such as circadian rhythm, cecal urease activity, or nutritional status, and small fluctuations in this analyte are different to interpret. As in other mammals, determining GFR is an important indicator of renal function because it's directly proportional to the number of functioning nephrons. All validated methods of GFR rely on clearance of a plasma marker, any substance that is freely filtered by the glomeruli, not bound to plasma proteins, and not reabsorbed, secreted, or metabolized by the tubules may be used as a marker of GFR. Various markers and techniques have been developed for GFR estimation, including plasma clearance of creatinine and urinary clearance of inulin. Measurement of inulin clearance is considered the gold standard. Such techniques are expensive and time-consuming, require collection of multiple and large amounts of urine or blood, so you can't really use it with small exotic pets or animals not adapted to frequent handling. Other techniques include quantitative renal scintigraphy with pharmaceutical radionuclides or clearance of gadolinium-based contrast medium via MRI. It's expensive and requires isolation of subjects or prolonged anesthesia. Iopamidol is an iodinated X-ray contrast medium similar to iohexol with pharmacokinetic properties that meet the requirements for a GFR marker. The measurement of plasma iohexol clearance rate involves repeated blood sample collection. Functional imaging techniques like CT can be used to monitor plasma clearance of X-ray contrast markers because of the linear relationship between tissue X-ray attenuation and plasma iodine concentration. This technique was developed in human medicine in the 1990s and has been adapted in dogs, cats, horses, pigs. As a consequence, the main indication for the use of CT-GFR for patients in which evaluation of GFR in individual kidneys is necessary, such as when nephrectomy is considered or after renal transplantation. Following nephrectomy, various renal modifications take place in order to maintain fluid electrolyte balance, such as decreased angiotensin secretion and structural hypertrophy and hyperplasia of the remaining kidney. In rabbits, those functional adjustments develop within a month after surgery and maintain a normal GFR. This period can be associated with transient kidney failure. However, these physiologic and structural adaptations lead to hyperfiltration and hypertension, resulting in nephron loss. Such adaptations have no clinical consequence if the remaining kidney is healthy, but can accelerate in the course of pre-existing subclinical disease if the remaining kidney is also diseased. GFR may be influenced, as in other species, by factors such as age, sex, circadian rhythm, hydration status, dietary protein intake. You can measure GFR in rabbits, for example, with inulin clearance by use of a single blood sample, resulting in a GFR of 4.01 mils per minute per kilogram in healthy rabbits in one study. Contrast medium clearance has also been measured in healthy rabbits via MRI, revealing mean values of 0.68 mils per minute per kilogram with one protocol, 0.845 mils per minute per kilogram with the second protocol, and 3.19 mils per minute per kilogram in the third protocol. Those are very different. By the Fregis effect, which is a physiologic phenomenon by microvessels, the hematocrit in smaller blood vessels is less than that in larger. Therefore, CTGFR could lead to underestimating plasma clearance from the blood clearance and hematocrit values. The nephrotoxic effect of iodinated contrast medium could also result in a temporary reduction in renal blood flow and GFR. The use of high doses of iohexol has been associated with contrast medium induced nephrotoxic effects in healthy rabbits. Use of a low-dose iodinated contrast medium and provision of adequate hydration are recommended. Another consideration for CTGFR requires subjects be anesthetized or sedated, which can impair cardiovascular function and GFR. So you want to have an anesthetic protocol that minimizes cardiovascular effects. A time attenuation curve called a renogram represents the pattern of renal enhancement over time. First phase is a vascular peak, corresponding with contrast medium before it's diluted by the circulation. Evaluation of size and width of vascular peak yields information on renal blood supply, and changes can be observed with vasoconstriction, stenosis, or interstitial edema. The second phase is the migration of contrast medium from the bloodstream to the nephrons, and the slope of the ascending part of the renal peak is correlated with GFR. Determination of GFR by use of the protocol reported in this study depends on the application of Patlack plot approach, which would be appropriate in some clinical situations. This Patlack approach is a two-compartment model. Its use is contingent on several assumptions, such as homogeneous mixing of contrast medium in the bloodstream, unidirectional transfer of contrast medium across the glomerular membrane, and no loss from the second compartment, meaning the nephrons and collecting system. So it's pretty neat study. I didn't know they would do this in rabbits. It makes a lot of sense, and it's not utilized enough with dogs and cats either, but you have to have the right equipment to do it and expertise. So thanks for watching. We'll see you guys in the next one. Take care.